The Hospital at the End of the Earth, Area C, was an overall great documentary that showcased many hardships that people from the area endured. Throughout my presentation, I will give examples of the health detriments shown in the film. The physical aspect of the environment was awful. It was full of sand, very dry, and hard to breathe for many people. There was no clean water, which is an essential component of living, and without it causes many to become ill. Area C was known as one of the popular places for cotton. The pickers would use the water in the sea for their cotton. Since so much water was being drained constantly, the water never filled again and caused the levels of salt water to reach higher. This thing caused the town to have no fresh water and has become a detriment to their health and function in a serious way. Since the water was no longer healthy, it caused many diseases to become prevalent. Other factors such as dry land and pesticides made many people become ill. An infectious disease called tuberculosis was very deadly. It causes excessive coughing, wheezing, loss of appetite, sweats, and a host of other symptoms. It killed approximately 3 million people. So many people became very ill, and doctors and nurses tried their hardest to help the patients. The patients stayed in hospitals and clinics, and at times there wasn't even enough space for everyone. But since the town was in a financial hardship, they didn't have adequate health care to help the patients. They had very limited medication and didn't even have enough for all of the sick patients. The patients even had to take the same medication for a long period of time, whether it helped or not, because that's all the hospitals had. There were so many people cramped inside the hospitals who lived near the sea and weren't able to go outside because of the conditions. It was better to be inside than outside. So many maintained their social environment with families. Many individuals in the hospital didn't see their families because they were so ill, so they built relationships with patients inside the clinics. For example, a patient named Dina from the film hasn't seen her family in a long period of time because of her illness and communicated with her roommates inside of the clinics. She didn't want them to come near her because of her sickness. Another key factor was genetic endowment. There was a large number of birth defects because of the diseases afloat in the area. It was hard for mothers to have a healthy pregnancy because of these issues. The defects were killing the babies, and the atmosphere made it no better. Individual behavior and biologicals caused so many to become very upset with the town in general. Many were aggravated and very emotional about the problems they were accustomed to. The biological aspect caused many offsprings to become ill because of the environment. There was no adequate health care or medication, which made matters worse. The well-being of health is very important. However, the individuals of Kazakhstan were faced with an unfamiliar tragedy. It's very challenging for them to be healthy when there's so much sickness and environmental issues around.